Now, because there hasn't been so much flu circulating, because we've been wearing masks and staying inside and all of that, I gather that makes it harder to be absolutely sure that this flu vaccine is highly effective on this particular strain of flu. As somebody who's had my flu vaccine, are you concerned about that?
So it's a more uncertain year, but I certainly would be encouraging everybody to go and get to the vaccine. As usual, we work with WHO. We look at what's happened on the other side of the world, because obviously their winter season comes first. And we have a multi-strain vaccine, so it will be two influenza A's and 2 influenza B's. But there is a slightly higher degree of uncertainty around that, partly because we've had such few cases, and partly because individuals' health-seeking behaviours, if you like, have meant that they perhaps haven't come to be tested as much, and therefore we won't have so many samples on which to base that decision.
So without scaremongering, we are a bit more vulnerable this winter.
Yes, I think the important message here is this is probably the first season where we will have significant amounts of COVID circulating as well as flu. People's behaviours have changed. We're mixing more. Winter weather is coming along. Everybody's going into enclosed spaces. And we do know from the small amount of data that we've had previously that people are at more significant risk of death and of serious illness if they are co-infected with flu and with COVID. And that doesn't seem to be, from our studies, a fact which many of the public understand.